Hi, I'm Dr. Wright, giving you common sense solutions to everyday problems. And if you like what you see and hear in today's video, please like and hit the subscribe button. In today's edition, we will be discussing the under $30 COVID-19 protection package. Let's get to it. It should be clear to everyone that the simple instructions of wearing a mask and social distancing will not stop the onslaught of COVID-19. As you know, I am the only proponent of the glove as the #1 weapon in the fight against the coronavirus. Specifically, gloves treated with sanitizer after entering possible points of infection, such as a department store or grocery store, where contact with carts and doors and a gas pump and the checkout machine could be the principal modes of contamination. With wearing a mask and doing that only, we are just ignoring what could be, in my opinion, the primary mode of transmission, which is tactile transmission, or in layman's terms, touching something contaminated and forgetting or outright neglecting to sanitize your hands, and thus infecting your household and your family members by touching food, them, or any number of things around the house, including touching your pet. Now, the Gloves Up protocol can remedy this problem, but if you want a nearly 100% protection package, this $30 kit will provide it. Let's examine it item by item and discuss what each could possibly provide. Let's talk about the gloves. Generally speaking, a pair of gloves and using good practices can be the #1 principle weapon against COVID-19, in my opinion. You've heard me say this time and time again. And we're talking about something that could be obtained for less than $2 a pair. And if you bought them in a bulk package or a bulk sale, it could be 50 cents or less. Now, again, the glove is the #1 part of the Gloves Up protocol, and along with a good decontamination agent such as hand sanitizer or what have you, it is the only form of protection that is 100% effective against COVID-19. Nothing else can say this, not even the best of masks. And speaking of which, we'll be talking about the N95 mask, which is the best thing that we can use as lay people. This is the only mask that has a 95% effective rate against COVID-19. Nothing else has this, not a surgical mask or, of course, not a cloth mask. The general cloth mask and a surgical mask will only provide incidental protection from the coronavirus. And what it does is it's going to prevent you from transmitting the disease from yourself to other people if you're positive, but it does very little to stop a person who has a mask on from getting a particle through the mask. So for about $6, this is a great protection against the coronavirus that only gloves have a better protection percentage. Now, the next thing we'll talk about is protective eyewear. Now, most people don't understand or know this, but the eyes can be susceptible to coronavirus because of the fact that there are mucous membranes, and it could still reach your face if you were walking into some virulent situation. The mask would stop you from inhaling it, but not it contacting your eye or you becoming susceptible in that regard. Now, the pundits don't reveal this to the general public, but they talk about masks. But if they were to make masks mandatory, as this is how we're moving, it should be mandatory also to have some sort of eyewear to block the transmission from coming to your eyes, because that is a factor whether we like to admit to that or not. The next thing we need to talk about is hand sanitizer. Now, gloves and hand sanitizer or some form of sanitation is the basis for the Gloves Up protocol. So that is something that's very important in this equation that we're talking about spending $1.50 for, sometimes less. But sadly, the spread of COVID-19 could be because of people becoming so confident or even overconfident in their mask that they neglect to use hand sanitizer, even bring it with them when they go out to public places, or to use it afterwards after they leave the place. And so for $1.50, we're talking about really cheap insurance against the coronavirus and keeping your hands sanitized. Now, Next thing we'll talk about is the home sanitizer, which is in a lot of different forms. It could be Lysol, or it could be this type of spray that I'm showing here. And this should be something that is sprayed on doorknobs, keys, handles, or anything that could be touched. This can also be used on gloves, as it's something that does not go through the glove into your hand, so it can't be absorbed and can't cause you any kind of harm. So again, it's something that you should have. It is a must-have in my opinion. The next thing we'll talk about is vitamin D3. Now, this isn't specifically something that we will talk about in terms of like how gloves or a mask is something that can block the transmission, but it's something that protects you in another way. This vitamin is an immune system enhancer that is vital to the protection of your body, because what it does is it supercharges the first line of defense against disease and infection, which is the immune system. And vitamin D is the best what-if vitamin against COVID-19. So there you have it, the super protection kit that provides every aspect that will protect you from COVID-19. Only the sanitized glove protects you 100% from tactile infection, but you can rest assured that short of a hazmat suit, this will provide a superior level of protection, all for under $30. I'm Dr. Feelright, and again, thank you for watching.